Welcome, welcome everybody. This is the December 3rd meeting of the Incarceration um, Prevention and Reduction Task Force Index Committee, which I am calling to order just after 2:30. Um, First, I want to start with our land acknowledgement. We had a discussion about this at steering committee and look forward to more discussions about how we can make this meaningful. So I encourage you all to reflect on it as we read. But we want to start by acknowledging that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events. All right. So, having said that, the most important order of business today is it's the end of a year and time to look to a new year. So, I am hoping that we can go around the room and everybody share their priorities for the most important action item we could take next year. First, I want to follow up on some unfinished business from this past year. And I will turn it to Perry and Caleb, who have been working diligently in a million different directions. And I appreciate the efforts that you've put in. Uh, I would be enjoy hearing from each of you who else you're working with and how we can make this the most meaningful way to gather data that is available for the jail. So whichever Perry or Caleb you want to take the lead.
I would like to defer to Perry for the moment.
Okay, that's fine. You're on, Perry. Looks like you got the hot potato in your
Uh,
lap.
just a little perspective on the life of IT and corrections right now. We just have been through a couple weeks ago a major upgrade of their jail commissary system, which has been challenging. And then we're this week is the big transition from to a new jail medical provider, and that started at 12:01 a.m. on Monday. So we've got there's probably at any given time this week, 30 or 40 new nurses and practitioners being uh, trained and learning how to provide the medical support needed in our correctional facility. So that has definitely distracted us.
I
Um,
think.
there, when it comes to data, and I think, Rick and Johnny's might be listening in as not as panelists, but as in the other room, so to speak here. But one thing that we've been working on is STV, which is part of the build group,
Mhm.
has requested some stuff with the Power BI. And so we IT have kind of done some configuration of our Microsoft tenant based on some best practices and things like that. But at the end of the day, we've got the county connected to some Power BI sites at FSTV that'll be part of. There's going to be a public piece that will be out there showing the progress of the build of the jail and behavioral health center. And so I think that has helped us advance our Power BI infrastructure.
Mm-hmm.
Um, and I think STV, we IT get requests from STV through Caleb on different things associated with jail data. Um, I don't know, Rick, are there any STV requests that you've gotten from Caleb that would be of interest to this group that you're working on?
I'm not sure if he's unmuted. Somebody, the host asked me to unmute. This is Janice.
Hi, Janice.
Hi, Birdie. Um, I don't know.
Well,
Yeah, Rick
all
should
right.
be
So,
joined, but I
so
think
we,
he's not a panelist.
oh, there he goes.
Yeah, I'm here.
Rick, are you aware of anything, are you working on anything for Caleb right now on STV?
For STV, no. I am actually working on something for Caleb right now, which probably
Right.
isn't a surprise, but not STV.
Okay. So then I think we've recently got an email from Dean and Birdie.
Mhm.
And then I know that Caleb put in a work request to the IT service desk for some information for us to work on for Marty and Holly.
Mm-hmm.
And so I know, I think that was like about 2 weeks ago, right, Rick?
I think that was
Last
Monday
week,
for the,
Monday.
yeah.
It's all a blur.
No, the
At least the
time
Marty,
becomes
the
a
one from Marty.
blur, right?
Yeah.
Yeah, so Rick, I don't know if you could share any, are you working with Caleb on that one in order to provide Marty and Holly with what they're looking for?
Yeah, most of those things on that list are not a huge challenge to produce. I just have a few questions about some of the wording I'm not completely clear on. I see the phrase jail aging. I'm not entirely clear on what that means or what you're looking for with that one.
I thought that's what it was called, where you say how long people have been in jail.
Okay. Yeah,
Wasn't
that's what
there's like a jail aging page or stats or something, which I feel like I've seen in the past. Anyway, that term came to my mind, so I threw it in there. But
yeah, I that's what I mean. It sort of clarifies it a little bit afterward, but I just want to make sure I understood what that was. The only other question I have about these is what is the end? I don't know how I'm trying to say this.
The
I can
output?
answer these questions,
Yeah.
yeah, but what sort of format would you like to see these in and at the end, like spreadsheet, graphs? I'm not sure exactly what would be ideal for you.
well, what we're trying to do just for the other people on this call is pull together stuff that already exists or is very easily accessible that we can share as share with the public, share with share online, just to give folks some preliminary kinds of data on process and outcomes that do exist already and start building the baseline and trends that can then be elaborated on and really made a whole lot better when we have a real data dashboard that's integrated with systems. But this is just a preliminary kind of low tech approach. So we're using as our format the Whatcom County Health Insights dashboard. And the way that looks is, well, they use Power BI and it's very beautiful. And we
Mhm.
weren't thinking that we could get anything that sophisticated at this point, but just charts, explain what's in it, explain what isn't, like, who's excluded, who's included, how it was calculated, and any interpretation that of the data, just so we don't leave it up to people to draw wrong conclusions, but just say, here's what we think the trend is and why this is important. So that's what we were aiming for.
I'm going to suggest, Rick, that could you share the the requests that came in, screen share the requests that came in from Caleb, and then other people can see kind of the data that we're working on for Marty and
Yeah.
Holly.
I need to promote Rick to panelist, and then he should be able to share. There you go. Johnny's, I'll promote you as well in case you
No
want
worries.
to share.
Left the meeting briefly and came back. So give me just a minute here to find that, Perry.
Yeah, I know it. I know it came into the service desk.
Yeah.
Just a question for others to have. I don't know how far the STV dashboard has been made available at this point in time. We know it's still a work in progress. But again, I think it's got a different mission. It's kind of trying to we're building these facilities, and what's the timeline, and how much local businesses are we using, and those kinds of things. But our support of that, light support of that effort has definitely helped us advance our county IT Power BI infrastructure.
Well, that's helpful.
So I think this is what we're looking for,
Right.
right? This is yeah.
Mm-hmm.
So we were just looking at the evaluation and performance measurement plan that Julia, the Village Reach, put together, and pulling the indicators that seem the most important and that we think we already have data for, like because it's posted online on the sheriff's site. But then Caleb and I, when we met, we thought of some questions that kind of would help to dig into the data just a little bit to add some clarity. And those are the ones that are mostly about racial disproportionalities in the data that are there at the end of the list.
I think for me, the biggest question when I look at this list, though, is how, for example, you have average length of stay for as many years as possible. Are you looking for a yearly average length of stay? Just
How do
by
you
year?
usually?
I can produce that as by year or by month.
I think at least quarterly would be helpful. I don't
Okay,
know how
yeah.
much work it is for you to add the burden of reporting monthly, but at least quarterly lets us see more trends than annually. What did the rest of you think?
I mean,
I think quarterly would be great.
yeah.
Okay.
I think what I'm interested in doing is like when we report on something like that, if we know there's other groups within the Justice Project that would want it monthly, we probably should do it monthly once, and
I
that
totally agree.
benefits everybody.
I don't think we should do anything differently. I just think annually is probably not frequently enough.
Yeah. But in the preliminary work that we've been doing with Caleb on early dashboards and stuff before things have been redefined, we were doing monthly.
That would be excellent.
So
That's fine too. We can definitely work with that, and we could just chunk it by month and then have the years.
And
Like we're trying to find trends, right? We're trying to demonstrate trends. So we'll be using like bar charts mostly, I think, or line graphs to just show what the direction has been over time. And anything you know about why the numbers were like going up or going down, that is super helpful.
yeah, and I think we should. I'm going to use the term that I don't know if everyone knows, but metadata, which is data about data. I think we should explain. Okay, average length of stay. There's different ways to do that from what we've learned from Caleb, and there's a way that we calculate it to make sure it matches nationwide standards. So, Rick, I think before we provide, as part of the data delivery to Marty and Holly, let's make sure, the calculation that Caleb has provided, the national standard calculation is visible, so that if there's any questions as far as how did this get calculated, it's clear.
I
That's
think that's very helpful.
Okay.
I have a slightly larger question. Annalise, Jonice, you're still on the call, right?
Yes.
Yes,
Yes.
great. I appreciate you being here and would really appreciate if you have the time to stay for the whole hour, because one of the things that I'm realizing, particularly in the last 3 months, when our major action item has been repeatedly asking Perry and Caleb for data that they have no ability or time to produce off the top of their head, and that's not a good model, and so while you're here, what would help me as chair and going forward for next year is to be able to have from you or whoever is appropriate kind of the sense for what's realistic for us to expect from county IT personnel. Because I don't like putting Caleb and Perry in binds where we're asking them to do things that they don't have the ability to do because they have so many other responsibilities. And I'm finding what I'm looking for the going forward is a way that we can be realistic. And so I think we are all aware that not just the index committee, but the goal of this whole project is to begin to get some available data that we can publish as not a sophisticated dashboard, but just some general statistics. And so I don't want to put you on the spot today either, but I would also love to hear from you in some fashion what's realistic so that we can be open and realistic about the things that we're putting in our work plan. Does that make sense?
Yeah, it sure does. My team has been down F3 staff for quite some time, so and we were
Well,
hoping to
yeah.
backfill Rick's position, and we did actually hire somebody, which was the good news at one of the last meetings, but unfortunately that person decided to go elsewhere, and so we're still looking to backfill Rick's position, but to free him up with some
Yeah.
time. So, but yes, absolutely, I can help with are things realistic, and we are making forward progress. And but as we get these requests, I can sure help with that, Bertie.
That would be really helpful
Yeah.
because as I said, it isn't very workable for us to put out these glorious work plans. And
Yeah.
then when we really know, some of us know that that's not going to happen. And so one of, so I would like to wrap up the kind of next steps on what we've just been talking about. And then we're going to move to reviewing our charge, but also reviewing what Peter and Heather have put forward as the draft plan for 2026 and see how and where we fit into that. And that's where it'll be very helpful.
Can I just, hey, Rick, you're still screen sharing? Are you intending to?
Oh, no. Yeah. Sorry. Thank you. I appreciate you pointing
Good
that out.
point. Yeah.
Glad I didn't have a bunch of
No,
data.
that's totally fine.
Well,
So,
you put up some geeky stuff, which
Oh yeah, no,
yeah.
it's trying to confuse everybody.
Hey, Bertie and
yes,
gang, would it be okay if I just shared the Health Insights page really quick so you all see
please
that?
do. Because what I would like to do is get a little bit of closure to this particular
Yeah.
discussion so we have a plan of what's going to happen. And it sounds like getting the data for the several players, Marty and STV and all, it makes a lot more sense than multiple individual requests. But I think it would help the members of our committee to know kind of where that's headed.
Yeah, I was thinking that too. So this is some of you might not have looked at this in a little while. I had not looked at it till that recently. So Community Health Insights, this is the landing page, and here you can go to indicators, and from here you can pick one, and I'm just going to pick this violent crime. And for this indicator, you see why this is important, a definition of how it's calculated. So that's what Perry was saying, like if we could just put the national standard for length of stay in here, that would be perfect. And then if there's a trend, you just use these little icons for the trend. It's up, down, or equals. And geography is comparing Whatcom County to the state or national, you might. Disparities is if there's any racial or racial, ethnic, or gender disparities that you want to note, or other subgroups, different groups. And then here is a Power BI chart that they have. Some of them have like 4 or 5 tabs. They're just beautiful. Did somebody from IT do this, or was that health department folks?
Health department.
Well, they are gorgeous. And you can like see the details if you hover, and you can click on data notes. And this is where we want to just have any kind of notes in here about what was the source of the information, and what, how were calculations done. This is stuff that just helps the viewer know what they're looking at. So any kind of information in here on the notes. Maybe there will be something explaining a trend in here, like, we saw numbers increase when we imposed, when we let off booking restrictions in in 2018 or whatever it was. So, and then some of them have other charts, and you can tab across the top and get to the other charts. So I just wanted to share that with you. Oh, and then they have Learn More, and this is where you can go to other sites to see more about that particular, whatever that particular indicator is. Yeah, it's really a nice site, and we are going to try and make something that uses this as a template, but it will be without the Power BI. They'll be more like, Word documents pasted on the website, I think, but at this point, just while we're low tech. But this is the format that we're aiming for, is to have those pieces of information for each indicator. And that way those sites that information can eventually be nicely integrated for our county, ideally. Thanks.
Thank you, Marty. Very helpful. So in terms of next steps, do any of those of you involved with getting this data for Marty and STV have any comments about what you see as how we get from where we are right now to the information given to them?
I have a question. Oh, whoops.
No,
Sorry,
please go
somebody's
ahead.
hand
You're
was raised.
fine.
Is there other data besides the data that you're requesting from Rick that is going to be added to the dashboard? Are you getting it from a lot of different? Okay.
We're trying to get everything we can get that's related to the 15 Justice Project projects.
Okay.
Actually, I'm just going to say 12 projects, because the first 3 are formation of committee.
Not data, yeah.
Okay.
Yeah. Yes,
And
if you have any leads, if you have any data that you think would be useful for that, we'd love it.
So, Janice, we were trying to approach this from data that already exists and
Yeah.
filter out a wish list of things that we would love to have that's not being collected, understanding the resources involved in that second. So, correct, Marty. So, what we're hoping for is, and if it would help you, for us to kind of give you a bigger landscape of kind of the places we're heading, and you can say no, yes, and the no's mean not this year. That would be, if that would be helpful to you, I think that we could find people to pull that together. I don't know if you feel like you're getting kind of nitpicked by various specific data requests without seeing the big picture, and that's really not our intent. So I don't know how, I would be interested in how Perry and you and Caleb and all comment on that and how we can be
Right. So
helpful.
we in IT always go back to it's the department's data, not our data. We're here to
Mm-hmm.
help mine the data with the okay from the departments to help meet the needs of what you all are looking for.
Mm-hmm.
And even within the last year or two, we worked with Caleb on some preliminary dashboards. And then after the benefit of all the different committees and the interests and things like that, a lot of the data was redefined and changed. I mean, we're measuring more on ethnicity and
Right.
other things that are, important to the community that were not as important in
Sure.
times. So, yeah, and again, with where we ended up last time, Bertie, and sorry that Caleb and I couldn't meet with you, but I think
Okay.
we were looking at those three indicators,
Mm-hmm.
daily booking, average length of stay,
Mm-hmm.
recidivism.
Right.
And I think we have the first two pretty darn dialed in, well
Mm-hmm.
defined.
Excellent.
And I'll look to Chief Erickson to correct me if I'm wrong. But those are, I think we understand those.
Good.
Recidivism is the one that is not a single thing. Like,
Oh, I totally agree. And
um,
how would you define recidivism to be able to provide data for that?
and that's where I would defer back to Chief Erickson.
Okay, so I mean, that's a really serious question on my part because I think recidivism is kind of a broad title, and if we're doing data, we want to have a very specific definition. Um, so if you were to choose and make it amenable to the data that you have, what would you use to give us some measure of whether we're making a difference?
I think Caleb's unmuting.
Yeah, I think you're still muted,
Yeah,
Caleb.
still muted, Caleb.
There you go.
Can you hear me now?
Yeah.
Okay. So I'll put together, I had to step away for a moment. I'll put together a small paper that outlines the various levels of recidivism.
Mm-hmm.
The challenges of defining recidivism is just the first step. The second step is, as you mentioned, Bertie, what can we actually get our hands around? So to specifically point it out, comparing one field to another field is where the difficulty comes in. For example, comparing a booking date to a release date.
Right.
Yeah, so that's the biggest challenge in actually getting the data to work for us.
Mhm.
But I'd be happy to send Jill the document that describes the various levels of recidivism. And I can't remember in this format if we've discussed those in
I
any
don't,
length at all.
not for at least several months. And then I think it might have been after the meeting formally ended. You, Perry, and I had a further discussion, and I remember you describing that. So that would be very helpful, Jill, if you could distribute that to us.
Yeah. And I do have to run. Unfortunately, I have an appointment to get to, so I have to step off the call. Before I go, if I could just make one quick mention. As we were listening, I think that Rick has done a lot more than maybe he's aware of. So we provided information to STV for all data points of every interaction in the entire system from the initialization of the system to date, which was sometime in the middle of the year, in order for them to clarify the jail capacity analysis.
Mhm.
And so I think that the disconnect there was that we use all these acronyms and it's not always clear who
Right.
is being provided the information. So Rick has done that, very helpful in that aspect. And then as Perry mentioned, we've had a number of asks over the course of the last few months. And specifically, things to clarify about the data that we've already produced. For example, Rick's worked very hard to come up with our quarterly and annual report. But one of the things that's obviously missing from that data is ethnicity, because we have some things broken down by race, but ethnicity, which is a separate um, uh, field entirely, is not captured in the data. And so
Mhm.
when Marty and I met, we discussed the idea of having some of that information uh, pulled together so that it can be displayed in a meaningful way to
Mhm.
understand, the ethnicity in addition to the race of the individuals who are booked and held in
Mhm.
custody. And so that's as we've gone to community engagement events, that's one of the pieces of information that's come out
Right.
that people are interested in hearing about. In addition
Mhm.
to just race, also a breakdown by ethnicity. And then I thought I had one more point, but I'm forgetting it. And again, I do have to step off. I'm sorry.
No, I know you do, and I appreciate your attendance. I know you're pulled in a million directions. I don't, if you have to go, go, but I would be very curious to hear if you had one priority for this committee to work on next year. I don't know if you've had a chance to even think about it, but I'd be curious to know what that would be. Um, and I don't want to put you on the spot if you just need to run. So,
Well, I will jump off here, but I think that for me, our priority should be to continue to work towards having a functional database and a data dashboard that is
okay.
meaningful and displayed towards the
Right,
public.
right.
So those
That's
are the
very
things that
helpful. Yeah. Okay. Thank you, Caleb.
yep.
And appreciate you taking the time to come and good luck.
Thank you.
Okay.
All right.
Um,
Bye.
hmm. Okay. So I don't want to overdwell on this, and by the way, welcome, Jeremy. We're updating ourselves on the first agenda item of the 2024 attempts to get some jail data and follow up. And there is efforts going on to meet a broader request from Marty and others for the overall justice plan and also for STV. And we've been kind of talking about that and getting down in the weeds. So all I want to do is have some one or two line summary for where we stand on that. And is anyone who owns this enough? Can anyone volunteer that?
So, the last series of conversations, Bertie, that you and I had was around the various data sources.
right?
And so we have lists and examples and samples from warrants to the Odyssey to Supreme Court, Municipal Court, and
Excellent.
the
Yeah.
jail. We have examples in the public health arena where we have combined and published, at least internally, dashboards around data from various sources and whatnot. And so that was less conversation, everything that was posted there, but that was posted earlier this year.
Hmm. So I guess it sounds to me, and Marty, please correct me if I am delusional here, but I think it sounds like if you being the entire IT department, could provide to Marty the data points that she's asking for with definitions, whether the definitions are by conversation or written or whatever works best, but provide those quarterly, we'd be in hog heaven, right, Marty? Because I think there are other folks that can take those data points and create the public facing kind of thing, which we would, of course, run by you before we ever put public to make sure you concur. I don't think we're asking you to do that. We're just asking for those data points.
Yeah.
Correct, Marty?
Yeah. And ideally, it would go back a few years, whatever's easy, like 2020,
Right.
2022, whatever's easy to current, so that we can start to demonstrate trends, you know?
And we know that COVID and booking restrictions were huge variables in that. And we would point that out extremely clearly because I know when I first started, everybody said you can't start comparing previous because there's been so many radical changes.
Yeah. So if
But
it
I
makes
think
more
at the same
sense,
time, it's useful so that the public starts learning, oh, when these things happen, this is the fallout.
and if it's easier to start in 2022, that's okay too. And, you know,
So is there anyone who's willing to stick their neck out and say this is reasonable and we can get it to you within 60 days, or this is terribly unreasonable and it's going to be 6 months? I mean, I think that's what we're looking for so that we can get the workers on the other side.
could we just
Right.
adjust
So,
that to a couple weeks?
What'd you
so
say? Did I hear you say a
Oh,
week, Janice?
oh, no, that was me. And I was
Oh,
just hoping,
okay.
we're just trying to get as much done in the next couple
I
weeks
thought
as
Janice might
possible.
need a medical check.
Yeah, well, she might
right.
after
So,
hitting me.
again, we work very closely with Caleb, and
Mhm.
whenever it comes to requests from the jail, I think I think his assessment and our assessment was this is pretty straightforward, pretty reasonable. Um, yeah, again, some of these we've already kind of worked on with Caleb.
Mhm.
So, if is the order of the bullets on your request, Marty, a prioritization?
Yeah,
So, I mean, I think we will, again, we've been just overwhelmed with correctional projects
I
on just
understand
their
that.
operational day-to-day stuff, this big
Right,
medical
right.
transition that's happening this week. But I think I get the sense from both Caleb and Rick as well that the request is pretty darn reasonable, and what we can do is certainly maybe provide a progress report to Marty, at the end of next week.
That would be excellent,
you,
And if we can try to, again, we need to work with Caleb.
right?
But again, I think some of these things are already worked out. So
That's what it sounds like. So it's more the operationalizing of it than it
it's
is.
just we got stuff coming in from all
Well,
directions.
I totally get it. And I
And
can only
if Marty and
imagine the
Holly's
pretty
if
new
Marty and
nurses
Holly's
you
stuff
train.
is top priority, then that helps us.
Yeah, yeah. Can you weigh in on that, Jonice, or am I putting you in too much of a spot?
Well, I would certainly defer to Perry. He is my
Okay. Yeah,
supervisor,
he's
but
the guy with the
yeah,
boots on the ground. Okay.
that's right. But yeah, and again, I don't think I'm being CC'd on the requests or whatever. So that would probably be helpful too. So Marty, maybe I can see a ticket come in the service desk, but maybe if you could just include me in those two. Um, yeah,
I
but
actually don't have that. It was Caleb who
okay,
sent
okay.
to
Rick on
Gary
Monday.
or Rick. I'm
Yeah,
not
okay.
sure.
Okay,
Don't
yeah, that
think I
helps too if I have visibility of things so I can help,
You
and try to
know,
answer some
right.
of the questions. But yeah, as Perry and Rick just said, I mean, the boots on the ground, really is Rick right here,
I
right now. We
know,
just
and
talked
I
about the details of
recognize
the
that
the
there's
data
only so
request.
much,
So,
but I think
oh
that
yeah,
somewhere in the progress line, we'd like to get it
oh
there.
yeah,
Okay.
yes.
All
But as
right.
far as if there's questions or if it's doable, or it sounds like if we have anything it needs to be fleshed out, it sounds like we're
All
pretty
right.
set with what we
Yeah.
need. So have
Yeah.
everything we need. So.
Okay. Excellent. Well, then I very much appreciate all your work on that. And I'm going to change the subject and move on because it's December and ready or not, there's a new year coming. So you can see if Jill, if you don't mind putting up the, we thought we'd get this in front of everybody. It was in the back on your spare time. Hopefully you all have looked at it. And at any rate, what I'm looking for is priority. I need one priority. And what I propose to do is go around and ask each person in attendance what their one action item is that they think we should prioritize. And the selection is really uh, the in yellow are the three goals that our chairs of the IPRTF really want to see the entire IPRTF focus on. And as you can see, data plays a significant part of that. And in addition, the portion underneath, which is the tradition that we're used to seeing, the focus topics and the action items. This is our standard work plan for the IPRTF, and those in bold on this are where our committee and data comes in. So my hope is that each of you chooses one thing from kind of these three yellowed ones and then those in bold down below. And Caleb went first because I called on him first. So I'm going to work my way down in the order that I see people. And I'm just interested in what your thoughts are. So, Perry, you signed on early and you're near the top. What would you say?
I would say that focusing on the content of the data of the dashboard is more important than the dashboard. And that is what I think Marty and Holly are trying to do right now.
Okay.
And so if we can flesh out this, here's the stuff off the shelf, and just get it to them quickly without any fancy links or
Mhm.
interactivity or things like that, and then have them vet the content,
Mhm.
we'll have a better chance of getting a dashboard out that meets needs.
Okay. That's very
So I don't know if I,
No, you're fine. I mean, this
right.
is exactly what I'm looking for. Something focused that we can get around and work on. So, Ryan, you're next.
Yeah, no worries. So Perry, I think is absolutely correct. I mean, it's about gathering that data. So from that yellow list, like number two seems probably developing tools to identify and track, that data is probably important. I can tell you from what I do, number one is actually, since I deal with community court and mental health court, um, so the court, mental health court, like Robin has, in fact, that's what we're meeting about in a quarterly meeting. She has
Mhm.
a ton of data from the last 10 years and is putting it all together. So you should that's pretty, I mean,
Wonderful.
those things already exist. Maybe that's an easy one to
Right.
check off because those, the only thing I don't know about is the felony, recovery court. But community court has similar data tracking they haven't processed it all, but they're tracking a ton of data, and that's Andrew Mitchell from Bellingham Municipal Court, who's in charge of that. So community court has that. We'll have tons of data. Mental health court has tons of data that Robin Willens is currently going through and charting it all out. So maybe that's an easy one to check off. I just don't know how much, but
Right.
I say that with the idea that Perry's probably also correct that still developing the data that goes into the dashboard is probably the most important.
Right.
But I just want to let you
Right.
know that
Okay, well,
there
I
is that
appreciate that.
diversion program data is out there and being collected by
Okay, so
people.
it's nice to know what are things that
Yeah.
could be within reach.
Yeah, exactly. Yeah. And should be like pretty thorough as well. Like they're already being
Yes,
tracked and they're
yes,
pulling reports on that. So
that
anyway.
is excellent. Okay, so let me go back to my list here. Uh, Jeremy.
Um, I'm hearing Perry Rice. This work is being owned by IT, correct?
Yeah, I mean, we're not asking the health department necessarily. I know that everybody, both the county IT department and the health department, are very sensitive about inviting extra work. I think what we're really talking about is what should this index committee, which is broader than just the county IT department, what should we focus on as our priority? And part of that work is what resources would we need, et cetera. Does that make it easier?
It does, but the question becomes again, who's owning the work? So
Exactly.
if we're
Exactly.
reporting metrics from Robin's program and reporting metrics from the jail, are we talking about the same group of individuals? Are they from the same population? Are they different
Exactly.
populations?
That's
Are,
exactly
do
right.
they
All that
cross
work
the
would have to
municipal
be
court, superior
discussed.
court? So from my perspective, and it's a well I keep going back to, there's this infrastructure conversation of
Right.
who owns the body of work, where is it being stored? I understand the political desire to publish something, and if that's the goal, then that's the goal. If
Mm-hmm.
the goal is to develop processes and data to improve system efficiency,
Right.
there is a level of analysis and visibility that goes beyond simply just publishing something.
Exactly. Yeah. Well, if I could speak to that, and I may not be reflecting the public at this point, but the sense of the conversations I have been in is what we publicize on a public dashboard is somewhat different than the data that we might use internally to look at how we're coming in terms of implementing the implementation plan and shaping our thoughts. I don't think the intent is to put everything public immediately for just the reasons that you're talking about.
And it circles back to that infrastructure conversation,
Right.
regardless of the audience, the
Yes, right,
source
right.
of that information has to be someplace. Hence, circling back to if Perry's team is owning that work, then it lets us know what our resources are in terms of staffing and
Mhm,
technology in order to
mhm.
leverage that. There's still the administrative overhead of getting access to information, especially around the court system, which isn't
Right,
specific to the diversion programs themselves, but to the
right,
court as an
right,
entire entity.
right, exactly. So maybe I'm not hearing you correctly, but I just want to check in. Are you suggesting that tackling that infrastructure issue would be the priority of this committee? Because not things can't progress further without that. Is that what you're suggesting, or are you
That
using that as an example of the difficulties?
No, that is the core
That's good.
complexity
Okay,
of the entire
good.
exercise. We cannot cook a meal without a kitchen,
Right.
and
Okay.
we can't answer the question of where is the kitchen and who's cooking.
Okay. Sounds good. My next is Amy Ebonal.
You guys hear me? So I often miss these meetings because I'm in a different meeting on Thursday afternoons. So I apologize. I am not caught up on everything.
Right. Well, we would still be very interested in your input.
Well, I don't know if I have anything to share, but
Okay.
I work at the Blaine Police Department, and Chief Roger Funk says Perry's a super smart guy. So I'll just agree with what he said.
Well, I know you work for the Blaine Police Department, and I'm mindful of the diversity on our committee, which can be a real strength. You're not buried in the IT department with Perry. At the same time, you bring a separate view of the data that you live with and what the public may or may not want, et cetera. So do you have anything that you want to?
Well, I work in records, and one thing I've learned is the public wants the most data that they can get.
Yeah, this is all true. Anything from, we have been mostly talking about once people hit booking into the jail and all things that happen to them after that. From your policing side, is there anything that jumps out to you that would be valuable, that would be available?
I mean, I think everybody can agree mental health help and drug.
Right. Okay. Yep.
So
Yep.
we see people over and over again. So.
Yeah. Okay. So focusing on data around those areas in particular.
Yeah.
Okay. Well, I appreciate that perspective. Thank you.
You're welcome.
Dean, you may not be official, but I am still calling on you as a member here.
Right. Well, I mean, I would echo what Jeremy said, that I think we really need to build the infrastructure that will allow us to collect the kind of data that then feeds into the measures that
Mm-hmm.
were recommended from the Village Reach report
Right.
as the measures that tell us whether we're accomplishing what we want to accomplish or not. So I mean, I think emphasis on let's start to build the infrastructure among the
Mhm.
various players, each with, each has its own set of data, and we need some infrastructure that begins to allow those data sources to communicate with each other. Um, it's sort of the old interoperability
Right. Right.
issue that we know about in the healthcare arena.
Right. Okay. Thank you. And Rick.
Oh, well, I don't know if I have much to add to that beyond what Perry said. I think he summed it up really well. I think the developing the data and the content for the dashboard is probably a little
Okay.
logical place for me, or focus for me. So
Okay. And I think, no, I've gotten you well, Janice, I'm going to call on you. You're not a member of the committee, but you're very influential in what we do. And so I would really love to hear, in a perfect world, from your viewpoint, what could the index committee choose as its top priority for the beginning of next year that would be amenable to your world and also helpful?
Um, I would kind of two things. I don't, what Jeremy was talking about, I am unclear on what the end product it is really intended to be, or if there's multiple end products as far as
Mhm.
um, because we have a gelada infrastructure, or there's things that the health department, I don't know maybe it's health HIM group or health
Right.
analytics, their data set versus some data that we have access to with Spillman, and I don't know what the end product it needs to be. And so maybe that's, as Jeremy was talking about, build the infrastructure. I don't understand what the infrastructure or end products need to be. So I think that would be helpful to get clarity on that. And then also, yeah, if you put bad data in or don't have data that answers the right questions, certainly that's an issue. So as we're working with Chief Erickson on the data, just making sure we have the right data elements to answer the questions. But
Okay.
figuring out what it looks like,
Right.
so I don't know if we need to build infrastructure, but we need a map of the infrastructure to understand all
Mhm.
of the data inputs and what the what feeds what, and that speaks to who does the work or who has that information. Because I know like Rick has worked with Jeremy historically, and they've got, some feeds from different data sets, and it's feeding
Mhm.
into something that the health department has access to that Whatcom County IT does not have access to. So
Got
we
it.
can't work with data or produce something that's not
Mhm.
not in our
Yeah.
house, or not,
Yeah.
we don't have
Yeah.
access to. So
Well, if we don't have if we don't know where we're headed
Yeah.
by knowing it, then we aren't going to get there for sure.
Yeah.
So
Yeah.
your point is very well taken, and that might be the very first step of going down that road. All right, and I think Lynette, you're now with us, right? So
Yes, I am here. Yeah, I
well,
agree.
out loud.
I agree, both Perry and Jeremy's sentiments, and I think just before we jump straight to dashboards and data collection, just really understanding the tools and the what are we trying to get at, what the goals are. I think. I think I originally, when I emailed you, voted for number two, like how do we track people across
Right,
the life
right.
cycle of these situations? And I think that will be helpful in building out like what are the key points, what are all the data pieces we need if we just took someone from start to finish, and who and what and where. So that's what.
Got it. Okay, I think I've hit everybody.
What about you,
Anybody?
Bertie?
What about me? Okay, good point. I didn't get to get off the hook, right? Well, I have kind of two, which would be nice if we could wrap them into one. And that is, I do agree that we need to define what the infrastructure is that we keep talking about and get explicit because that is a key component. And maybe that's the very place to start. And I also, would like at least to start thinking about Lynette's point of how do we follow someone across the interface, because that's going to determine how we impact the infrastructure and the data sets and everything else. I mean, I'm acutely aware with even in the jail that it's not simple to say, okay, this person was admitted, now he was released, has he been readmitted? You know, it sounds lovely, but the fields don't allow that. And so how can we track people in a broader sense if that's already a barrier? So I think naming those barriers with an eye on then prioritizing how we address them might be the best thing this committee could do. I see some nodding heads. I don't want to, I mean, what I've heard is two major themes, which I think are intimately related. One is we have to understand the content and what the data is and what it means in order to build the dashboard. And that's a good place to start. And the other is the role of infrastructure and who owns what data and how do we communicate that data with each other in order to do more than very limited. The health department publishes it, the jail publishes it. And so I think they're really related. Does anyone want to add anything to that or modify that at all? Because I may be the one trying to put this in writing and you all may disagree and I want to know it. Speaker
I
for
think it was a
everyone.
nice summary, Bertie.
Okay, thank you. So I appreciate all of this. And the next question I would ask, we're down to 1 minute. Okay, so it's very important that I let you know that the county overall, and Jill, correct me if I'm wrong, as the committee at the subcommittees of IPRTF move to meeting pretty consistently every other month, the way we already are, we will be switched to a January, March, et cetera. So our next meeting is January 8th. So perhaps we can, for that meeting, flush out a little more what we've been talking about. And I would really be interested in other members that you think would be important to have, either by name or by position. Yes, Jeremy. Did you raise your hand or did I I
No,
guess not.
no, I'm gesturing to somebody leaving the
Sorry.
room. Sorry.
I saw your hand fly up. But I think it would be a useful discussion at our January 8th meeting to reflect on the type of people that we need as members of the index committee in order to tackle the data definitions and the defining the infrastructure needed. So in all your spare time over the holidays, you can meditate on that. But I want to thank all of you for your participation this year. I know it's been quite a ride for everybody with everything else going on, and appreciate you faithfully coming. And Jonelise, thank you very much. I'm pronouncing your name wrong. It's Jonice. Apologize. Thank you for your presence and your support. And please feel free to communicate if there's things we can do differently. Okay, so now we need public comment. And then, Jill, is there anyone here that would like to comment?
We do not have any attendees today.
We promoted everyone. Good work. Okay. All right. Well, thank you very much, everybody. Happy holidays and see you very soon, but in the next year. Okay. Take care.